سامان افتخاری رنجبر. I'm a graduate of Master of Science in the University of محقق اردبیلی. Our title research is influence of rigorous interval training with sodium nitrite supplementation on Klotho and resisting levels in type 2 diabetic rats. In the introduction section, type 2 diabetes characterized by elevated blood glucose levels. Angiogenesis plays a crucial role in the gross tissue regeneration. Age-related diseases like diabetes, muscular atrophy, and bone fragility often involve impaired angiogenesis or endothelial cell dysfunction. Sodium nitrite has been investigated as a potential treatment for vascular dysfunction associated with diabetes. This study investigated the effect of high-intensity interval training with sodium nitrite supplementation on Klotho and resisting in rats with type 2 diabetes. Klotho acts as an anti-aging suppressor via multiple mechanisms. A specific expression of Klotho in beta cells improves function and reduces type 2 diabetes development. Circulating Klotho levels predict long-term macrovascular outcomes in patients with type 2 diabetes. Resistin plays a vital role in glucose metabolism regulation and is implicated in various metabolic, inflammatory, and autoimmune diseases. In conclusion, diabetes and obesity continue to rise globally. Vascular complications in diabetes rank among the most frequent chronic issues associated with the condition, leading to increased mortality and disability. Angiogenesis play a critical role in the development of diabetes-related microvascular complications. Regular exercise promotes various adaptations in the body such as angiogenesis and preserving existing blood vessels. Sodium nitrite provides angiogenic end effects in vivo and in vitro. Data: a statistical society and a statistical sample. The target population comprised type 2 diabetic rats that have undergone 8 weeks of high-intensity interval training. The sample included 15 rats, also with 8 weeks of high-intensity interval training acquired from Tabriz University of Medical Sciences and housed at the Sara Laboratory Center in Tabriz. These rats are 5 groups: healthy control group, diabetic control group with sodium nitrite supplementation, diabetic group with 8 weeks of high-intensity interval training, diabetic groups with both 8 weeks of high-intensity interval training and sodium nitrate supplementation, and diabetic control group. Material and method sections. You can see here sample collection and analysis. Klotho levels were measured using the rat kit, lab science catalog number EEL R2580. Resisting levels were measured using the rat rating kit from lab science with catalog number EELR0614. Material and method sections. Diabetic induction methods. Rats are induced with diabetes after 20 weeks of diet and intravenous injection of 25 mg division kilogram body weight STZs. Sodium nitrite supplementation protocol. 2 groups of diabetic groups and diabetic groups along with 8 weeks of interval training received sodium nitrite supplementation. High-intensity interval training protocol. The high-intensity interval training protocol lasts 8 weeks with 5 weekly sessions. Each session consists of 6 repetitions of 3 minutes at 90% MRS, followed by 3 minutes at 50% MRS. During the training sessions, the incline was increased by 5 degrees every 2 days. The speed was increased by 2 meters per minute, and the daily exercise time was increased by 2 minutes. The MRS included 5 minutes of running at a speed of 13 meters per minute at 10-degree incline, followed by an increase of 3.6 meters per minute every 2 minutes until the exhaustion. A statistical analysis. We have used the Shepherd-Wilk test to show the normality of data distribution. and the ANOVA, the Bonferroni post-hoc test, was applied to locate differences between the group, and all these statistical processes were carried out using the SPSS software. Result sections. Here is the test, the result of Shapley-Wilk test for each variable, and as can be seen, the significance value is greater than 5% and the data has a normal distribution. We have Resistin, Klotho with 5 groups. Healthy control, diabetic control, interval exercise, sodium nitrite, interval exercise plus sodium nitrite. Here are the values of research variable in different groups, as you can see. The amount of blood sugar in different groups, and the results. We are talking about Resistin. The result of ANOVA test statistics showed that there is a significant difference in Resistin levels in heart tissue among the groups. The Bonferroni follow-up test also determined that the healthy control group had significantly lower Resistin levels compared to the diabetic control group. However, there was no significant difference between the interval training plus sodium nitrite group and the diabetic control group. Furthermore, there was no difference between the diabetic control group and interval training and supplement and interval training plus supplement. There was no significant difference between the exercise group and the supplement and exercise plus supplement groups. There was no significant difference between the supplement groups and the supplement group plus exercise. Now we are talking about Klotho. The result of the ANOVA test show a significant difference in terms of cardiac tissue Klotho values among the groups. The follow-up test result also indicated that the Klotho value in the diabetic control group was significantly lower than that in the healthy control group. Additionally, the exercise plus supplement group had significantly higher Klotho value compared to the diabetic control group. Furthermore, in terms of Klotho values, there was a significant difference between the diabetic control group and the exercise group, as well as the supplement group. No significant difference was found between the exercise and the exercise plus supplement groups in terms of Klotho. No significant difference was found between the exercise and the supplement groups in terms of Klotho values. Discussion section. Diabetes effects on resistin mechanism. The complex mechanism behind the observed increase in resistin levels during diabetes involves several factors, including insulin, glucose, and leptin. Resistin, secreted by adipose cell, is a unique signaling molecule for insulin resistance. Its levels are influenced by anti-diabetic medication, obesity originated from dietary and genetic factors. Klotho and diabetes, mechanism of action. Klotho levels, on the other hand, may be influenced by insulin, which aids in the release of Klotho from its membrane. However, as type 2 diabetes advances and severity of nephropathy increases, serum Klotho levels may decrease. Conclusion section. In sum, the study revealed that an 8-week regimen of HIIT alongside sodium nitrite supplementation could significantly modulate Klotho levels in type 2 diabetic rats. Nevertheless, it didn't significantly impact their resistin levels. It is suggested that people with diabetes participate in sports activities such as intermittent swimming to reduce the risk of cardiovascular disease. Also, consider using supplements such as sodium nitrite along with exercise. A combination of interval training and sodium nitrite intake leads to better results. It is suggested to investigate the effect of interval training and consumption of sodium nitrite on bloodstream in human samples. Thank you for your attention.